Welcome to Primary Care Today on ReachMD. I'm your host, Dr. Brian McDonough, and with me today is Douglas Seifert. He is the founder and CEO of Syandus. And Douglas and I actually had a chance several years ago to talk about the project he was involved in, his company, and it's very exciting for a physician audience. It's actually fascinating. So I'm not even going to steal the lead. I want to have you talk about it, Doug. Tell me a little bit about your company, what you're doing, and how it impacts physicians.
Well, what we do is we combine game technology and systems engineering, and to be able to infuse clinical algorithms into medical topics. And we've created a platform for physician education where we actually create these medical scenarios where we have responsive patients that are, come to life and respond, and the underlying clinical algorithms, so they can actually go through, differential diagnosis or go through treatment through a responsive simulation. And that's on the clinical side. And then we've developed with a number of our medical society partners a patient tool, which we really be able to have patients learn about the disease of if they're newly diagnosed and don't really understand what they should be doing, or self-management within a chronic disease. And we help them go through that process of understanding how to self-manage their condition.
Well, Doug, you're talking to the right group in primary care today, because we have a lot of primary care physicians who I know they're, as like I am, they're salivating thinking, wow, this would be great to be able to explain COPD or heart failure or any number of conditions to patients. We describe it all the time, but to have something like that where there's a tool for them for education. How did you even get into the idea of doing this? What's your background and what led you to do this?
Yeah, well, my background is a PhD in biochemical engineering, and so we mentioned systems engineering. So a lot of I come at this from a very different approach, which I think kind of makes it our pretty unique. We started all this with a National Science Foundation Small Business Innovative Research Grant way back when, and had 7 successful awards from them since then to really build out the platform. And that's how it all started. And I think the real interesting focus is trying to find ways of utilizing this very powerful technology to kind of plug into this new healthcare environment, that the transformation we're seeing today.
One of the things I do, in addition, chairing my Department of Family Medicine, is I'm a Chief Medical Information Officer. So I'm constantly looking at what we're using as far as our electronic platforms and, using this technology in medicine. But as you know quite well, and I'm sure our providers out there know, it's very early on in the process. What we're doing as physicians, we're just kind of entering data and getting things together. We're starting to e-prescribe and do things, but I love the concept of things you're doing, because it'd be great to be in an exam room with a patient working through their diagnosis and maybe linked to an ICD-9 or in the future ICD-10 code. Yeah. You could actually show a patient things that impact their own health. Are you looking at things like that in that direction?
Yes, we are. What we're seeing is that I think we all understand with self-management that if we can get the patient to be better at self-management, particularly with all the chronic disease, is we're going to have better outcomes. And the challenge is we all know how to do it. It's coaching of the physician in the office or a nurse, and that there's just no time for that, and to scale, and that's difficult to scale. And then you have call centers where you can have nurses that do coaching, and that's starting to become more prevalent. And I think one of the challenges when we're talking to the various healthcare organizations, particularly the ones that are moving into this more accountable care model, they see that that's really what they need to do, and they have the challenge of scale. And what we see is a huge gap then of if you can't, you can only do so much of that in-person coaching or coaching over the phone because of it's resource intensive. And then after that, it drops down to just, same type of one size fits all web-based materials for patients, and there's a huge gap in there. And that's where we see where if we can capture the clinical coaching and software and provide an experience for the patient, that then they can become, by going through that, they can then interact better with their physician. They know what to do. They start to understand. They understand the disease better. They understand what they're supposed to be doing, and they understand what kind of questions they should be asking their physician. And so that's the gap of we're trying to fill with software. And we're, as you were indicating, we see it as a way you almost prescribe it as here's some valuable experience for you that you can learn what's happening with you and how you can help yourself, and that can be a step to help forward that their self-management and improve care.
If you're just tuning in, you're listening to Primary Care Today on ReachMD. I'm Dr. Brian McDonough, your host, and today I'm speaking with Doug Seifert. He is founder and CEO of Syandus. And by the way, for people who are listening to this or have downloaded it as a podcast, is there a website or a place they can go where they can kind of get a glimpse at the technology and what you guys are doing?
One of our first programs was in multiple sclerosis. We worked with the Consortium of Multiple Sclerosis Centers, which is the largest professional society for multiple sclerosis professionals and physicians. And that program is available on iTunes and also for PC and Macs. And so they can go to myalivemed.com and it's available there, or they can go to the iTunes store and access it there. It's Virtual Conversations in MS.
So mylivemed.com, just MYLIVE med.com.
Mm-hmm.
Okay, or the Virtual Conversations. That's great. And obviously, the other great thing about podcasts is people can rewind it and they can write it down and take their time to get the information too. But what I'm excited about when we're talking about this, Doug, is the fact that, we were just talking, as you said, like, I think it was 2 years ago, and we're talking about how technology has changed and what you've done even since then, but also the medical world has changed. You talked about accountable care organizations. It's now, there was a time when, it seemed like insurance companies were fighting the physicians who were fighting the hospitals it was like everybody was more or less protecting their own turf. More and more now, I think, at least what I'm seeing in healthcare from my perspective, is everybody's trying to figure out, okay, there's limited dollars. We're sharing a lot of this stuff. How do we all work together? And how do we get the patients to be so much more involved in their own care? And patients now care more because their insurances are telling them you got to kind of pay a little bit more up front because you're carrying more of those initial expenses before they start kicking in with insurance. So it seems like everybody right now is ready to try to educate patients even more than they have in the past. And this may be the time for something like this where there's an opportunity to make it, for lack of a better term, more interesting, more like a video game, more exciting, because let's face it, that's what a lot of people, that's the world they're living in.
Yeah, yep.
When you see all these things and the excitement of that, there's the other side, which is education of physicians and helping them as well. Do you have an arm which is involved in that, like educating the doctors?
We do a lot of work in continuing medical education, and that was the what I said up front about our medical scenario simulator, where we actually provide risk-free environment where they can go through various scenarios around specific disease states and go through and solve the scenario from a treatment standpoint. And we're using underlying clinical algorithms. So as they're going through, there's not just one path through. It's not like a case study. They can take different paths depending upon, for example, what treatment they start with might affect what options are available down the line as you revisit that patient. And what's great about the simulation, you can simulate. We've done oncology simulations that simulate a patient that you're seeing a patient over 3 to 5 years, as you're going through different treatment regimens and what the choices are based on what you've done before. So we've been very excited about that as well.
What do you see as the next 2-3 years as you're going forward as the exciting steps that your company's taking and how it could impact either patient education or physician education or both?
I think on the patient side, we're really excited about what you were just mentioning with that. I think the whole infrastructure is starting to come into play. That the first step is, I think, with patient engagement has been the logistics of how do we get patients more involved in healthcare, from getting them the appointments to pre-authorizations, all those sorts of things done. The next step after that, I think, is self-management. I think with chronic care, we all know, 50% of the population has at least one chronic disease, and so that's really where the self-management, what we're doing, can really impact, I think, a large population, because it's scalable. It's by capturing the clinical practice that experts that use in their offices. If we can capture that in software and then have these virtual conversations that are completely interactive with patients, they can actually learn through these virtual patients and a virtual nurse moderator in ways that that simulate what would actually happen if they were in an office.
And I think for primary care providers in particular, and again, those of us who do it on a daily basis, I might talk to 7 people in the course of a day, let's say, about a certain type of headache or back pain or issues of chest tightness, these types of things, and we go through the explanations again and again and again, and all of us as physicians get pretty good at it. But the idea of having something out there which would help, doesn't replace it, but you have that initial conversation. In effect, you can almost have your appointment when you see the patient, take it to the next level, to the next series of questions, and use the time even more effectively, knowing really quickly whether they have that baseline information down too. But and using that, like you said, it's taking it from economies of scale. You're able to use that again and again and again in different ways.
Yeah, that's exactly right. I think that's what we're trying to do, is augment the physician, be able to have a better physician-patient dialogue by having the patient being more knowledgeable. And I think that just is benefits both sides tremendously to be able to have the confidence for the patient to be able to interact that way.
A technical question for you, not too technical because I don't know enough about I don't know enough about engineering to be that technical, but I know from working in the IT world indirectly as a CMIO, engineers think a certain way, physicians think a certain way, and one of the flaws in a lot of the EMRs as they've been built is they're built in the way engineers would think, which may not be the way the real world of a physician thinks. And we see it again and again and again, wishing that more physicians were involved in the design. You seem to either have worked with physicians or you just innately know how to do this, because I remember looking at what you're doing and seeing that it makes more sense to a physician. It isn't like you're entering into an engineering world for the non-engineer. How have you done that? How did you figure that out?
When we were applying the engineering is really underneath, and what you're talking about is kind of the interface and how you're interacting, and that all has to be done at for the targeted audience. And so we've spent a lot of time with physicians along the way to learn how they like to receive information and how they would like things set up and what they expect, so that we can capture that in software. So the more the analytical part that we're capturing is all underneath. The part that makes it feel intelligent is the systems engineering part, that when it responds, when you make a choice and it's responding in an intelligent way. That is, the kind of the magic that we're trying to do behind the scenes. But I think you're right that if you apply that sort of logic up front on the design phase, then it's just going to fall apart. And maybe that's what you're seeing.
Doug, I want to thank you so much for taking the time to join us on Primary Care today.
Well, thank you.
This is Dr. Brian McDonough. If you missed any of this discussion, please visit reachmd.com/primary care today to download the podcast and learn more on this series. Thank you for listening. And Doug, thanks for joining us.